Hi, my name is David, and you're watching the The usage of drugs are widely seen throughout the history, with the usage of opium seen as early as 5000 BC by the Sumerians, and the earliest historical record of alcohol production by Egyptians in 3500 BC. But how much do you really know about drugs? And are they really dangerous as most of the media portrays it to be? Well, let's find out. Stimulants, also known as uppers, act on the body's central nervous system and are associated with a feeling of extreme well-being and increased mental and motor activity, causing the user to feel as if they are speeding up. Effects of stimulants are known to increase the user's level of alertness, heart rate, blood pressure, breathing, and blood glucose levels. When the effects wear off, users typically feel a drastic loss in energy. Often coming in the form of pill, stimulants can also be consumed by snorting or as food and drink, being prescribed by doctors primarily for ADHD, narcolepsy, and asthma. Stimulants also aid in weight loss as they can decrease appetite in users. Examples of stimulants include caffeine, ecstasy, methamphetamine, and cocaine. Like stimulants, depressants also act on the body's central nervous system. However, unlike stimulants, depressants are known to slow down the body and seem to give feelings of relaxation. Hence, why they are sometimes called downers. Often used as a prescription drugs for relieving stress and anger and other medical issues such as anxiety, insomnia, etc. The sedative experience from these drugs is not a healthy feeling for the body to experience. Examples of depressants include alcohol, tranquilizers, barbiturates, benzodiazepine, and gamma-hydroxybutyrates. Hallucinogens affect the body's self-control, such as speech and movement, and often bring about hostility. They work by disrupting communication within the brain. Users report intense, rapidly shifting emotions and perceptions of various objects and images that are not really there. Hallucinogens come in many forms that can be smoked, eaten, ingested as pills, and even mixed into beverages. Aside from causing changes in a person's perception of reality, hallucinogens are also known to cause heart failure, increased heart rate, higher blood pressure, and changes in body's hormones. Examples of hallucinogens include lysergic acid diethylamide or LSD, salvia, and psilocybin or magic mushrooms. Similar to hallucinogens, dissociative drugs distort the user's perception of reality and cause users to dissociate or feel as if they are watching themselves from outside their own bodies. Much like hallucinogens, these drugs work by interfering with the brain's receptors, specifically the chemical glutamate, which plays a significant role in cognition, emotionality, and pain perceptions. Users under the influence of dissociative drugs may gain a false sense of invincibility and engage in risky behavior such as driving under the influence or unsafe sex. Dissociatives come in a variety of forms and can be taken as liquids, powders, solids, or gases. Examples of dissociative drugs include ketamine, dextromethorphan, and phencyclidine. Opioids and opioid derivative drugs can cause drowsiness, confusion, nausea, respiratory complications, and is often associated with causing feelings of euphoria and relieving of pain. Derived from poppy plants, opioids are powerful painkillers that are often prescribed by doctors to patients suffering from intense pain. These drugs are extremely habit-forming, sometimes cause addiction in as little as 3 days. Increased dosage of opioids can induce coma and can be smoked, eaten, drank, injected, or taken as pills. Examples of opioid include opium, heroin, morphine, hydrocodone, OxyContin, and codeine. Probably the easiest drug to get your hands on in this list, inhalants are mostly made up of everyday household items that can cause brief feelings of euphoria. Inhalants give the user immediate results when sniffed or huffed. However, these immediate results can also result in sudden mental damage, as when inhalants are taken, the body becomes deprived of oxygen, causing a rapid heartbeat. Differing slightly from inhalant to inhalant, the effects include liver, lung, and kidney problems, affect sense of smell, difficulty walking, confusion. Examples of inhalants include glues, paint thinner, gasoline, laughing gas, aerosol sprays, and room deodorizers. Most commonly recognized as marijuana or weed, cannabis acts like hallucinogen, but also produces depressant-like effects, causing feelings of euphoria, confusion, and memory problems, anxiety, higher heart rate, as well as staggering and poor reaction time. Although it has a high potential for addiction, cannabinoid has seen increase in medical uses in the United States. They can be smoked, vaporized, and eaten if the THC is first rendered from the plant matter. Examples of cannabis include marijuana leaves, hashish, hash oil, and cannabis-based medicines such as sativas. Steroids are known to improve physical performances as well as to enlarge muscles and increase strength. However, it also has negative effects including baldness, cysts, oily hair, and skin acne, heart attack, stroke, and change in voice. Hostility is also a frequent side effect of anabolic steroids. Examples of anabolic steroids include anadrol, oxandrine, durabolin, stanozol, and dianabol. Lastly on this list, a group of very helpful drugs when used properly and when under the guidance of a qualified physician, prescription drugs. These drugs are known to be used as aids in surgery, treating medical conditions, and control various symptoms. However, prescription drugs are sometimes misused and abused, which can cause very dangerous results. Examples of prescription drugs are previously mentioned in this list, such as opioid group of codeine, oxycodone, and morphine, depressant group of barbiturates and benzodiazepines, and lastly, stimulant groups of dextroamphetamine and methylphenidate. Although side effects of usage and abuse of drugs can vary from drugs to drugs, it can range from anywhere between anxiety and paranoia to enhanced senses and euphoria, as well as other medical issues such as organ failures or brain damage. While some side effects are relatively mild, many abused substances lend themselves to severe and life-threatening outcomes. Short-term effects that occur in drug users depend on the amount used, the potency or purity of the drug, and whether it is mixed with any other mind-altering substances. It can also affect a person's thinking, mood, energy level, and perception, and may impair motor functioning, interfere with decision-making and problem-solving, and reduce inhibition as well as cause a host of physical health problems. Examples of such short-term effects include mood swings, impaired judgment, and coordination issues in alcohol, anxiety, paranoia, heart palpitation, and blurred vision in hallucinogens such as LSD or psilocybin, euphoria, nausea, vomiting, slurred speech, coma in opioids, and delusions, dizziness, muscle weakness, and impaired coordination in inhalants. Long-term drug abuse can have disastrous physical and mental health consequences as the body adapts to the presence of a substance, requiring increased amounts of said substance to experience the desired results in a process known as tolerance. Users continuing to increase dosage may show physical dependence on said drugs, which may subsequently give rise to unpleasant and sometimes deadly withdrawal symptoms once the person stops using substance. Examples of such long-term effects include liver cancer, pancreatitis, high blood pressure, and stroke in alcohol, persistent memory impairments, psychological dysfunction, sleep problems, and imbalance of hormone production in ecstasy. Sexual dysfunction, tuberculosis, HIV contraction, infection of the heart lining, and nasal bleeding in opioid in both intravenous and intranasal usages. More deaths, illnesses, and disabilities stem from substance abuse than from any other preventable health conditions. Along with physical problems, drug abuse can also affect one's social life, as the abusers often neglect responsibilities because of the fascination or obsession with taking drugs. People depending on substances have a higher risk of having unintentional injuries, accidents, risk of domestic violence, medical problems, and even death. Such health problems include weakened immune system, cardiovascular conditions, organ failures, seizures, strokes, as well as affecting the brain by showing signs of aggressiveness, impaired judgment, impulsiveness, and loss of self-control. Birth defects are also a major outcome of substance abuse, with results such as premature birth and learning and behavior problems. While most people correlate the usage of drugs to something that of harmful and negative, most drug usages are, in fact, not. Most drugs are used carefully under the guidance of a trained physician that can help most humans in ways we never thought. For example, drugs such as statins and metformin are known to aid in more successful cancer treatments, and certain beta blockers are used to lower blood to reduce the risk of dementia. Other drugs such as cannabinoid and morphine that are widely known to be as one of heavily abused drugs are used in medical facilities to reduce pains in patients. Furthermore, recent studies of marijuana showed that it may have the potential to treat glaucoma as well as reverse the carcinogenic effects of tobacco and improve lung health. Not only that, marijuana can help in controlling seizures, stop cancer cells from spreading, decrease anxiety, slow progression of Alzheimer's disease, and many more positive health effects. It is clear that certain drugs are highly addictive and can definitely cause severe health problems. But with even the most hardcore drugs out there, when used properly under a careful guidance from a trained physician, it can be a major factor in saving your life. That is it for today, and as always, thank you so much for watching, and I will see you guys in the near future.